Hey guys, it's Steven here from CORE Therapy and Pilates. I want to do a quick little demonstration today on some simple tips of using the TheraCane. I get a lot of clients that have had a TheraCane for some time, or we talk about home programs, and the use of a TheraCane comes up frequently. Now, a TheraCane is this guy right here. It's got the big long hook on the end of it. It's got a few knobbies on the side and whatnot. And the basic 3 tips I want to go over today are the 3 spots that most people need to help loosen up for their neck pain and neck tension. So the first thing is to get up between the shoulder blades, an area right here called the levator, and then back a little further between my shoulder blade and spine, the rhomboids. And so what you're doing is you're using the cane to pull that way and that way, out and down, to get into that tense spot. Now this is something you're going to find some knots, especially those desk workers and whatnot. So that's the first spot, between the shoulder blades up the very tip, all the way down to the bottom of the shoulder blade. Alright, so that's your TheraCane spot for the levator scapula and the rhomboids. The next spot we're going to talk about is the chest, the pec minor. It's a little muscle right here that we spend a whole lot of time teaching people how to release. The little knobby on the end here can be used right here. It's the muscle between the sternum and the armpit, just above the chest, below the collarbone. And then your pressure this time is coming straight in. And as you come in like this, you're going to feel some tension there. And you're just going to hold that spot there for several minutes. Now these are alternatives to what I teach people to use with the gold ball and the tennis ball. But these are things that are certainly of value. Now right here is the next point we're going to get to. It's called the scalenes and the SCM. Now that's an area that's very challenging to get to because of all of the other structures that are there, the lymph and other things in there, nerves and whatnot. So it's a very delicate area. So the TheraCane is very firm, so if you put that piece right there, it's pretty firm and uncomfortable for many. So I like to take a pool noodle. I just cut a little piece of pool noodle and I put it right on the end of that knobby. And then by putting that there and putting that knobby there into that spot, that is a lot more effective. And then I can do a little thing where I stretch my neck like this away from where the pool noodle and the TheraCane are at. I can look back like that. I can look down like this. Whichever gets the most tension to where the knobby is. So those are 3 simple tips that I want to go over using the TheraCane, the rhomboids and levator in the back, the pec minor in the front, and the scalenes and SCM on the front side. And again, you'll want to use the pool noodle on it with the scalenes. All right, that's it for today, guys. A little simple demonstration to help with neck pain and tension.